years and was subsequently given the opportunity to pursue his career as a physician leader in Raffles Medical Group Singapore in 2012. He was managing the 24-hour Changi International Airport cluster, overseeing operation for all the cluster clinics. He is passionate about public health care, and Dr. Choi later co-founded Doc2Us. It's a telemedicine platform and is incorporated in Kuala Lumpur. And since 2015, Doc2Us has grown to reach more than 100 partner pharmacies across Malaysia, prescribing more than 700,000 e-prescription, and has been operating at the forefront of the digital health and telemedicine industry in Malaysia. So with that introduction, I want to invite Dr. Raymond to speak on the topic telehealth and telemedicine, implication to older Malaysians. Dr. Choi, thank you.
Okay. All right. Hi, good morning, everyone. Morning. Yeah, so hopefully it's not too early for everyone. Right, I think Dr. Wong has introduced briefly about myself, and I'm not going to talk much about myself. So I think today's topic probably will be very different from the topics that you have been having for the past one day, or maybe today or tomorrow. So so today we'll talk a little bit more on technology, especially the health tech. Right. So the agenda today will be I'll talk a little bit on the use case in Malaysia, using the telehealth, telemedicine, and then we'll talk about the region and how is adoption like in terms of telemedicine, telehealth, and of course we'll talk about the implications on the elderly people with regards to the telemedicine and telehealth. Right. Okay, you can see my screen right now. Okay, good. So today's topic, telehealth and telemedicine implications to older Malaysians. And as we all know, I mean, of course, for this conference, silver tsunami is real, right? And aging population is no joke. So we definitely are dealing with huge challenge in Malaysia and even around the world that, aging population is a real problem. And how do we actually, take care of all this aging population in a more coordinated, more innovative manner with, better, safer, cheaper, faster kind of healthcare services to our patients and, of course, to the healthcare providers, right? Okay, so I think Dr. Wong has mentioned about myself. I'm not going to go through this. So for ourselves, we are from Doc2Us, which is a telemedicine platform, which sounds like Talk to Us. And I'm sure, like a lot of healthcare providers here, like myself, we always, were approached by our friends, families, and relatives, right, asking you about, any healthcare or medical related questions, right, and we'll try our best to answer them, or even refer them to the surgeons or the doctors that we know will be, that will be in good health, right. And it just got us thinking one day, right, what if those people without such, a privilege or access, where do those people, seek information from? And that was in 2014, right? And that we had this crazy idea to really, build a platform so that we can actually connect the patients, the consumer, to the healthcare providers, so that they can get, reliable, evidence-based information. And of course, with this platform, we hope that they can get, more services, end-to-end services like, electronic prescription, online consultation, medication delivery services, home care services, dispatching, carers to home, and things like that. So that's how we started in 2014, and we built the platform for 20 odd months and launched the program and the apps and the system back in 2017 in Malaysia, right? So if you realize, right, in telemedicine or telehealth, there are quite a number of players in the world, right? In Malaysia, there are quite, easily, 5 to 10 players, right? You really can't differentiate all the telemedicine players, right? So because it's just like, you go to e-commerce, Lazada, Shopee. I mean, we have the sponsors, Shopee here, right? Sorry to say that, right? And the functionality and the outcome are the same, right? So you go in, shop around, browse around, pay, check out, get the goods delivered, right? The only difference you can see is actually the color, the branding, the logo, right? The functionality and the outcome will be the same. So likewise for telemedicine, it's the same. So you go on, do a virtual consult, and get the, your problem solved, or even get the medication delivered to doorstep. That's the same, right? What differentiate all the telemedicine player is actually the ecosystem that they built, right? And for us, as you can see on the right side, teleconsult is a bread and butter for ourselves. So we provide virtual consultation to, corporate employees, international patients as a second opinion, of course, to the consumers, which is the public. And of course, we also develop pharmacy solution where, like it or not, in Malaysia, a lot of time, the first point of contact or first point of care, usually they like to go to pharmacy, the community pharmacy. Why? I mean, there are a lot of reasons. Not to say they are not going to clinic kesehatan or hospitals or private clinics, but usually for general, medical issues, right, they probably will go to a pharmacy first. One of the reasons is, which we study that is, of course, you don't have to register. Right, the barrier to entry is lower. You walk into the pharmacy, and the pharmacist will be readily available for you, right, to answer your query, and the consultation is free, right? So they don't charge you on that, and of course they get a quick access to medication that they need, these are some of the points that as a healthcare providers ourselves we need to understand how our patients are behaving, right, including the elderly, right? So they want quick access, simple, convenient. Right. If you look at, the latest, McKinsey study, or they study the survey all the stakeholders within the ecosystem, healthcare system, and they came up with the result that the first value proposition of all the stakeholders, actually agree on is actually convenience, right? The values that the stakeholders are looking at is actually convenience, and it's not about safety. Safety is actually second or third, right? But the first thing is actually convenience. So if we are providing healthcare services, if we can actually also look at the value of convenience, then I think it provides a great value to our patients and also to our providers as well. I mean, technology is supposed to simplify, to make things easier and better and more convenient, not only for the patients, but also for the healthcare providers, right? As we implement our EMR, right, electronic medical record, if you have to, do more things on the EMR, that means we have to rethink whether the EMR, the electronic medical record, is of a good tool to our practitioners, right? If a practitioner is spending more time on keying in the data on the system while compromising the contact with the patients, the face-to-face, right? That's the beauty of face-to-face, right? Of seeing the patients and all this. So then we have to rethink whether technology is actually complementing our practice, or actually it is not. It's just for the sake of data input, right? So a lot of things that we need to think through, right? So for e-pharmacy solution, we actually developed the e-prescription system. So imagine in the UK, you have NHS, right, where the GP prescribe, the Boots pharmacy will dispense. So everything flow within the cloud. Right, so likewise, we have implemented this cloud-based remote e-prescribing and e-dispensing system using digital signature system in full compliance to the Ministry of Health requirements, right? So this is the solution that we provide to the pharmacy. And of course, the left side, one of the ecosystem is actually, our brick and mortar business, right? So in healthcare, we can't do everything online, even though we are the tech company. We all, agree. I'm sure all of you will agree with me, or even argue with me that, how are you going to examine the patient using digital way, right? So yeah, we totally understand it, because in healthcare, we definitely cannot go 100%, digital, no matter how advanced the technology is, right? Because human touch, you can't be practiced. Empathy, you can't be practiced, right? More or less in virtual world. So and let alone the physical examinations, right? And we're always being challenged by the doctors say, how are you going to examine the throat? Someone coming with symptoms of acute appendicitis, how are you going to examine that, right? Using your video consultation, we can't. Right, so that's why the threshold for referral for all this, virtual consultation is much lower as compared to your physical, consult, right? So we believe that a hybrid care model should be the way where online and offline working closely together, complementing each other. But some people might argue, I prefer to go, offline. Throughout my medical training or my healthcare training, I've been taught about, offline services. I never thought about, online. So why should I adopt online, right? I think this pandemic outbreak has proven the values of digital health, right? And you know, if we actually, you know, keep practicing our healthcare, you know, services, everything offline, I think it will not be relevant for today's and tomorrow's healthcare needs, right? We have to look at the market, right? Of course, you know, healthcare providers do not like the word market, right? Because we're talking about patients, but like it or not, we are dealing with patients and the behaviors are different, right? So we have to understand the patient's behavior and what's the market needs, right? Instead of we thinking that what we do is right, right? Yes, of course, ethically, professionally, we need to do things right, and safety is always a top notch, right? But at the same time, we need to understand what are our consumers, our patients are actually evolving to, right? So we are in the 5G era, right? So we have to understand them and how can we actually leverage on technology and make our practice safer, better, cheaper, and faster, right? And of course, surer as well because of, you know, talking about precision medicine and things like that, right? So in a nutshell, this is a bit of a milestone. You know, we started in 2015, and you know, as you can see, you know, we developed something, and also we integrated MySejahtera. And if you look at technology adoption in healthcare, right? One of the best adoptions in Malaysia is MySejahtera. So before MySejahtera, before COVID-19, people will always argue, no, you know, those B40 group, you know, they won't, you know, they are not tech savvy, you know, those elderly, you know, they are not tech savvy. How can you, you know, go digital, right? But if you look at MySejahtera, like it or not, right, we have majority of the population have MySejahtera, right? So this is, of course, by enforcement and not by, you know, willpower sometimes, right? It's similar to China. If you look at China, as far as, you know, those rural area, the farmers, they are using WeChat, they are using e-wallet, right? And of course, this is a top-down approach, right? Which is, you know, from the central government, they say this is what we want to do, one currency, one e-wallet. So likewise for MySejahtera, it's a classic example. Things can be done if we have the willpower to really digitalize it, right? Imagine if today, we are still, you know, when we do the check-in for contact tracing purpose, we still do the, you know, handwritten, you know, on the book. Can you imagine how messy it is? And maybe you can't, because if you look at the public health side, right, the CPRC side, right, I think, you know, they'll go crazy to do contact tracing. We are dealing with 30,000 cases, right? No way, you know, we can go by paper. So MySejahtera is a classic and a great example of, you know, going digital is possible, right? And it depends on how willing we are politically or whatsoever, right? So I think, so I'm just giving you an example, right? Nothing is impossible, right? MySejahtera is a good example for everyone to really think, right? Going digital, elderly or not elderly, B40, M40, T20 is possible, yeah? Okay, so a little bit of wrap up of 2021, what we did in telemedicine, right? So we saw 1 million patients and consumers last year, and through our pharmacy, through our corporate, and through public, and we did, you know, more than 330,000 e-prescriptions. To date, you know, every 46 seconds, as we speak right now, we are generating 1 e-prescription nationwide, and we have done more than 700,000 e-prescription through our pharmacy, corporates, and of course, consumers. And our doctor's response time, when you actually request to consult the doctors online, you know, is about average less than 1 minute, 38 seconds last year. And we're trying to improve this as much as we can. And we're like pharmacy, like Watson's, Big Pharmacy, Alpro, they're actually using this digital solution. And there are more than 1,000 pharmacy outlets adopting these services. So you see more and more, you know, healthcare facilities and, you know, providers are actually adopting the digital solutions, and this is very encouraging. And we are, you know, getting a lot of data, right? Getting data is one thing, but how do we make use of the data, right? To make it more insightful, more meaningful for the patients and for the providers, as well as for the policymaker and payer, right? In healthcare, it always is about 4 Ps, right? So in healthcare, it revolves about 4 Ps. First P is always patients, right? Second P, providers, right? Third P, policymaker, right? Like it or not, healthcare is the most regulated industry of all, and it's the most complex industry, like it or not, right? And sadly, it's the least disrupted industry because of the, you know, the policy, the laws, and the health and safety of patients. And the fourth P, and we all always forgot, is the payer, right? In healthcare, who is paying, right? And of course, in Malaysia, we are very lucky and privileged that we have a great subsidy from the government on all these clinical kesehatan, the government hospital. And of course, your payer, like, out of pocket, which is, the private patients, the corporate employers, as well as the insurer company, right? Okay. Oh, so a little bit on the MySejahtera. So, so 2 years ago, when we first, encountered the pandemic outbreak, I'm sure everyone still remember MCO1. That was March time, right, 2020. So because of the MCO, we realized that there are a lot of, there's a huge communication gap where, no one knew about COVID-19, right? We all knew was Wuhan, right, coronavirus that time. And so we thought, people in the public, they speculate things, and so we thought, why don't we rally a group of, voluntary healthcare providers to step forward to really, provide virtual health advisory to the public for free. So this is not an email style where, the providers will reply you in 2 days time. This is a real time answering our public. So we managed to rally more than 100, healthcare providers to step forward, ranging from infectious disease specialists to GPs, to nurses, to dentists, right, to really step forward voluntaries, providing 24/7 services to the public. Right, that was in March 2020. Initially, we were answering questions like, what is COVID-19? Should I wear mask? Right, and all the way evolved to, what kind of brand is good, in terms of vaccines, and then to, what should I do? My family members all got COVID-19 until today, 5 to 10, 11 years old, should I get my kid, go for Pfizer, things like that. So because of this, 24/7, and we managed to actually, to date, seen more than 2.2 million hours of sessions with the public. And in July 2020, that year, actually we integrated with MySejahtera. So in your MySejahtera, maybe you not realize that actually under the digital healthcare, you can actually connect to doctors, healthcare providers, and that's for free. And our team, voluntary, will be able to answer any COVID-19 related questions. And this is what we have been doing. And every day we're answering hundreds of patients' inquiry and all this, because when during 2020, when the COVID-19 hits very badly, the government side and quite occupied in terms of all the ambulance, all this, and people are crying for help, right? So at least there's a communication platform for them to get answers, to get referral, to really get them to know what to do next when you got COVID-19, right? Yeah, so that's the part of the virtual health advisory that actually some of the public already experiencing, actually healthcare can be provided virtually, right? Of course, that is a virtual health advisory. It's not a virtual consultation, right? So I think this is a reminder to everyone in the stakeholder, including the tech company as well. So telehealth or telemedicine are not here to replace any physical care or any physical healthcare providers, but they are here to complement the healthcare practice, to complement the professionals, to complement the patients, right? So that we can provide better, safer, cheaper, surer kind of healthcare services to the people, right? Okay, so the growth of the telemedicine during the COVID-19, I think, the next few slides I'll show you, the adoption was crazy during this pandemic outbreak, not only in Malaysia, but around the world, right? And as you can see, the downloads of all these medical apps, grew more than 50% year on year, right, because of COVID-19. And the market, of course, is huge, right? So actually, the studies show that, usually it might take 10 years for hospitals or healthcare facility to adopt telemedicine or digital health solution. But this pandemic outbreak, it has, accelerated the adoption. For instance, when the pandemic came, you saw a lot of private hospitals in Malaysia actually rolling out different form of strategies, initiative, including telemedicine. Because initially, this group of hospitals, they lost a lot of patients, right? Foreign patients, Indonesian patients, all these are not coming to Malaysia, right? Because our borders were closed, right? So that is a huge drop. I mean, in business, right? I mean, private hospital is running a business, like it or not, right? There's a huge drop of revenue, right? So how do they continue to sustain with all the specialists and all the healthcare providers and workers in the hospitals, right? So hence they actually came up with a lot of initiatives and reached out to patients in Indonesia, right? Reach out to patient in Singapore, Thailand, Vietnam, right? And because Malaysia is one of the best medical tourism country, right? So they have a lot of patients outside around the region. So they roll out, telemedicine in 4 weeks, right? Usually it needs to take about 3 to 5 years for hospital. So you can see, because there's a trigger, there was a big trigger, and that was a pain, right? Usually people change because of pain, right? Because, change can be painful, right? So because there's no choice for hospital to really pivot and to evolve themselves. So you could see that the adoption of telemedicine, was skyrocketing during the COVID-19 period of time, right? So in China, one of the best, the top, digital health companies called Ping An, Good Doctor, under Ping An Insurance. During this pandemic outbreak between 2019 and 2020, the adoption of telemedicine went up to 900%. Yep. So that is crazy, 900%. And if you look at the rest of the health tech players in China, easily few 100% adoption. So some people ask us, how do you envision Malaysian digital health in next 3 to 5 years? Actually, if you envision the current China will be our future Malaysia in 3 to 5 years' time. So the adoption of digital health is actually much more, advanced than in Malaysia or even in this region of Southeast Asia. So probably this is the good reference for us to see, where we were heading to, right? And if you look at Southeast Asia, Singapore, the adoption of telemedicine during this pandemic outbreak is more than 100%, and likewise in Indonesia as well, right? So the various applications of digital health, there are so many. These are some of them. You have mobile health, right? You talk about mobile technology. Of course, you have a health information and technology, the hospital information system, your electronic medical record, the clinic management system. All these are under the health information technology. And of course, precision medicine, genetics, genome testing, all this, right? And really to make sure that, we are able to provide more precise kind of a care to the people, right? And of course, when we take so much of data, how can we actually provide, predictions on this group of patients, especially the elderly care, right? How can predict that this patient in 5 years' time, the risk of, CVD, right? The risk of stroke, right? Based on all this data collected, right? Of course, telehealth and telemedicine, robotics, advanced, prosthetics, 3D printing to make, the prosthetic, cheaper, better, and more personalized, right? So of course, the AI embryo checkups, biotechnology and things like that, right? Okay, so the benefits of telemedicine, I'm sure everyone aware, and of course there are a lot of downside of it, right? And of course, like I say, based on McKinsey, survey, the top value people are looking at is convenience, right? So if we actually focus our care on convenience, instead of every time, getting our patient to come back to see us, is there alternative way, to ask patients that we can actually see them, at their home, right? Or bring care to home or go virtual, right? For instance, your refill or prescription, do they really actually have to queue up for 4 hours to get the prescription? A lot of them actually, especially B40, they have to stop their work, right? And B40, health is not their luxury. Health is not their priority. So we have to understand, can we provide, better convenience to our patients, right, using technology? So this is something that we need to think through, right? And of course, telemedicine will ensure a better efficiency, in an hour, a doctor physical consultation, how many patients can they see, right? As opposed to teleconsult in an hour, how many patients can they see online, right? And of course, not to compromise the health and safety and the quality of care and things like that, right? And of course, you are able to reach out to wider group, the rural area, provided our infrastructure is ready, right? So, rural area, if the infrastructure is ready, so don't talk about technology. We have to go low tech, like SMS, right? In digital health, it's not really about high tech. It's really about how can you provide values to our people using technology. It can be SMS, right? You not necessarily need to do, virtual consult, video or whatsoever. All right, it's SMS to remind the patient to take their drugs, to remind the patient to take their blood glucose. That works, especially for certain B40 group, right? And they're very SMS driven. So we have to understand the behavior of our patients and consumers, right? And of course, using digital health actually is proven to be more cost effective. And like it or not, in the corporate segment, actually, we have done some study based on our data that actually we are able to optimize the medical expenditure of all these big companies of up to 40%. Imagine a big company spending, 10 million on medical benefits for their employees. With adoption of telemedicine or digital health, actually they pay 40% less in a year. So that's quite substantial for the multinational company, especially in this pandemic outbreak. So cost is also a factor that we need to think through, right? And of course, a lot of times, as a healthcare provider, we actually do not think a lot on the cost, but we have to think for the patient because of the sustainability. If we every time prescribe Mycardis, Crestor, right, all these branded drugs, right, and patients are not able to afford, they can't sustain, right? So we have to think at the socio-economic status of the patients, right, and can we make it better and cheaper, but the outcome might be almost the same. So that's something that we have to look at as well. The cost is a very important factor in the healthcare equation, right? And of course, you can go borderless, early detection and diagnosis and continuous engagement with the patients, and you can guide and help, the caregivers. So another type of remote health is not about, going to the consumer. It's actually how can you actually send the nurse, the aligned healthcare workers, right, and to see the patients at home while, with the presence of the online doctor, right, and partnering together, instead of sending the doctor. Sending the doctor is very expensive, right? We don't send doctors to home, right, unless it's some private patients. So that's something that technology can do as well, right? And look at the older groups of populations, and definitely I think we are, I'm sure a lot of speakers talk about, is definitely the silver tsunami is real, and the aging population is increasing, right? And we are living in a very, very odd situation when it comes to technology, right? So we have a very elderly who are not very well exposed to technology, or maybe not very savvy in technology. But you have other group of people, the millennials, the XYZ generation, they are very well versed in 4G, 5G and technology, e-commerce, e-banking, right, e-health. So that's a huge gap, right? If you want to implement digital health solution nationwide, it's going to be very tough because you do not want to marginalize certain group of people, right? Healthcare should be inclusive. It shouldn't be exclusive, right? And it should be accessible to all. So we are living in a very, very, awkward situation whereby, we have to take care of this elderly, right? And at the same time, our resources, our manpower definitely are not enough. And how can we use technology? But the adoption of technology on this group of people also quite challenging. So that's why it is not easy for the policymaker to implement, nationwide. So there are a lot of barriers and challenges. But I think there's a will, there's a way, and MCHA is a good example. Yeah. So the older groups and NCDs, I mean, there's no brainer, right? We're seeing more and more patients, and in the younger age, getting non-communicable diseases, and the NCD management is something, COVID-19 aside, right? NCD is a huge problem, right? Early detection, diabetes, all this, right? And we still have a lot of people walking with diabetes without them knowing it, right, on the street. So there's still a lot of things to be done. And this COVID-19 has exposed the lacking of public health in Malaysia. And actually it has, given the trigger to the government that we should focus more on public health, right? And NCD is real, right? So how can we better manage the NCDs? And and COVID is just seasonal. It will go, it will come. Second pandemic, who knows, might come in the future, right? But NCD is here to stay, right? So how can we continue to take care of them so that we can actually prevent them from getting all these complications? In a way, you're reducing the healthcare cost for the country, right? So it's something that for everyone to think through. The NCD is still our bread and butter, right? Not COVID-19. COVID-19 is seasonal, it will go, right? And soon it will be endemic, right? And maybe we are in the process of endemic, right? Okay, so this is a morbidity slide, telling you the common NCDs. I'm sure all the healthcare providers here know better than me, all these NCD cases and all, right? So the implications of telemedicine and telehealth on the older groups, right? Really, if you look at all this while, a lot of times we have been practicing disease-centric care, right? When I say disease-centric care, meaning when you have this illness, we treat your illness, right? We don't look at the 360 holistic approach usually, right? So I think the world has evolved, the healthcare industry has evolved to what we call the value-based care, right? And how can you provide values to our patients, right? So there's a definition of value-based care, which I'll show you later. If we as a healthcare providers actually focus on all these matrices to provide value-based care, I think we definitely will do, the patient will be more empowered, more encouraged, right? And then I think the NCD issue will be able to improve, right? And of course, accessibility and acceptance adoption of technology will be the implication as well, right? So not to forget, the care given, by adopting telemedicine, right, for low-income elderly, the B40 group, is a challenge for sure, right? And for the B40 group, as I say, health is not their luxury. It's not their priority. The priority is the needs, which is the job, the work, the money, food, right, housing. All these are their needs. Of course, someone may argue nowadays that B40, one of the needs is actually the data, right? So they are very prepaid kind of group of people. So prepaid means in terms of the mobile services, they are very prepaid, they're cash paying. But when you ask them to go to do the health check, usually it's tough, B40 group, right? So we have to understand the what's their perception of health, right? And that's why you see the NCD in B40 is very, very bad, right? And how can we actually, have some initiative to help them to, right? So I think in Ministry of Health recently, I think last year they had some, pilot studies and pilot work on, really, penetrating through them on diabetes, all these diabetic patients, right? By having regular SMS, right? The system send them SMS to remind them, and to educate them on, diets and all this. And it looks like it's quite encouraging, the data, but I don't have figures with me because I was part of it as well. And so I think the MWH will try to do more to reach out to this B40 group in terms of managing their NCD. And it's a huge challenge for the policy maker, for the government as well, right? When your group of patients, they don't perceive health as their priority, right? So how can we change the mindset, the perception on health? A lot of awareness and education needed. Yep. All right, so I was talking about the value-based care. So maybe you can put it down if you want to make the note. This is internationally recognized. Value-based care is defined as the quality of care multiplied by the outcome of care, right? This was the old definition. Last year, they added 2 more, which is the user experience, in this case, patient experience and safety, divided by cost. As you can see from this equation, the lower the cost of your care, the better the value. And likewise, the better the quality, the outcome, the user experience, and the safety, the better the value that you are providing to the patients. So if you focus on these 5 matrices, and these 5 matrices has to be measured, right? So there are ways to measure your quality of care. There are ways to measure your outcome of care. For instance, the hospitals, what's the, the rate of people coming back to the theater second time, right? All these are the outcome. So we have, this is a very, very, general, and there are a lot of things inside, right? But this is just a general idea. How can you actually value add your patients, right? Patients nowadays no longer looking at, I have cough and cold, I come to you, you treat my cough and cold. I think patients nowadays are looking for more, right? Why would patients, spend so much time on virtual, right? One of the reasons, because a lot of times our, not to say our doctors are not taking care of them, because the load is just too high. They don't have enough time to spend to patients like, 15 to 20 minutes to talk about NCD prevention, talk about smoking cessation, weight management. Our doctors just do not have the time, right? Our clinical setup, they're seeing hundreds of patients every day. Where do they get the time to educate the NCD patients? No. Then how can we use, certain technology to empower them, to reach out to them, to educate them, right? And really looking into these 5 matrices, right? So maybe for everyone to think through, looking at these 5 matrices, how can you improve your quality of care? How can you improve the patient's outcome, right? And their experience with you. The experience not only when they're coming to your door, to see you, right, as a doctor, right, for all the doctors here. The experience, starts actually as soon as, they walk into the clinic, to the center. registration, the ambience, the nurses, how they greet them, all these are the patient experience, right? And the waiting time, right? And the dispensing time, all this. So there are a lot of things that we have to look into and improve, right? Yep. Okay, so the next is accessibility to wellness and healthcare, and so I think I talked a bit on that. Acceptance and adoption of technology among Malaysians, as I say, is not easy, but there's a view, there's a way, right? Asian population is still possible. MySejahtera, I would say MySejahtera is a classic example. You see a lot of elderly, right, adopting MySejahtera, probably better than a lot of other young ones right now. They know how to, declare themselves RTK negative, right, on MySejahtera. So really, there's a will, there's a way, right? It depends on how willing we are to push this initiative, right? And obviously, MySejahtera really make it more convenient for our policymaker to really study the data, the demographics, right? All this, and of course, for patients, it's actually no touch technique, right? For consumers, you just scan the QR code and you can enter the right instead of everyone touch the pen and and do the handwritten style. So you can see this simple example. It proves that technology has its way to play to improve all this, right? Yeah. Okay, so the challenges of acceptance and of course the perception of technology and the data privacy is always one of the challenges. When you go online, when you go virtual, one of the challenges or people always ask, how is your data security, right? And we are dealing with a very sensitive personal health record. We are not dealing with, normal, data, that you do a normal survey, anonymous, but you're doing, with your name, with your demographics and your medical history, right? Those can be very, very sensitive and personal. So how can you, when you go online, that you prevent the leakage of all this data to the bad people, right? There are a lot of hackers outside, in fact, in the black market, they sell your data. And your data is valuable. It costs a lot, right? So there are people who are buying it. So there are certain group of people who buy it from the black market. So if you ask me, how can you prevent data leakage or breach of data, right? And of course, there are a lot of ways to prevent it. It's really about minimizing the risk. There's no 100% data security in this world. I give you an example. Singapore government, right? They had, a few years back, they had the leakage of data from the Singapore government, all right, on the personal health record. Even the Prime Minister Lee Hsien Loong himself, his personal record was leaked, right? So the hackers are always in front of us, right? They will find ways, innovative, creative ways to hack into the system. Really, it's about how we minimize the risk. It's about the whole virtual infrastructure, the server. Is it HIPAA compliant? Is it safe? Is it secure, right? And if there's a data leakage or breach, what's the SOP? What's the protocols, right? All these have to be in place to really ensure that the damage has to be minimized, right? There's no one can safely tell you, even Microsoft, Google, or Facebook can tell that, we are 100% safe. No one. So let alone, the healthcare providers, the health tech, right? And so it's really about acknowledging it and to react fast, right? So that is something that we can do, right? And of course, the best way is you don't go online, right? Even when you go on your social media, Facebook, you are online, right? Your images have been captured in the world, right? People, you never know, will use your picture, right? Are you going to go offline forever? Maybe, yes, it's your choice. But is it relevant to you? Maybe you'll not be able to connect it to people, right? So, I mean, it's arguable. So it's a choice that we make, right? It's a choice that you make. So there's no right or wrong. Imagine it's a choice that you make not to download MySejahtera, because the moment you download MySejahtera, your record is online. You like it or not, right? And MySejahtera is handling billions of data of yours, right? Have you ever concerned about that? Right? Maybe some people might question it. There are still people using written sign in. There are still people, but this group of people is getting smaller and smaller. So it's something for us to think about, and it definitely one person like us, we cannot do much. It has to be involving all the stakeholders within the industry to move this forward. If you want to really, adopt digital solution. Yep. Okay, so I hope I didn't bore you guys too much and about technology and digital. And so this is some of the experience that we have and some of the survey that we did. And I hope it makes sense. And ultimately, technology is here to stay. It's how we actually, use it, adopt it in a meaningful way, right? And not to forget, this is not here to replace any one of you here, right? It's for you to adopt, for you to make use of it, right? Thank you very much, everyone.
Thank you, Dr. Raymond. For those who come in late, I summarize in 1 minute what he has just said. What I heard is that healthcare must be inclusive. It must include those who are poor, the B40s, the elderly, and also technology. In Malaysia, MySejahtera has breached some of this barrier of using technology. The pros of using telemedicine is convenience, and it must be win-win for all the stakeholders, the patient, the physician, the payers, and the government. So the win-win is for the benefit of all these stakeholders. The disadvantage of telemedicine is that you are not able to examine the patient, so it doesn't replace the conventional face-to-face consultation. With that summary, I want to thank Dr. Raymond for giving us a summary of telemedicine. And he's one of those few brain that come back to Malaysia, and hopefully his company will do well and provide a good service for Malaysians. Thank you, Dr. Raymond.